Welcome to the Women Arise podcast. I'm your host, Reverend Neely Hicks, and today's session is brought to you by the National Association of State Mental Health Program Directors. This is the second one in a series of 3 town hall meetings that address the Surgeon General's recent report on the epidemic of loneliness and isolation in the United States. With us today are speakers Raul Almazar, Shireen Caraco, Mary Ferrari, Vesper Moore, and Rich Hollett. I know that you're going to get a lot out of today's session, so on to Raul.
Good afternoon or good morning, wherever you are. I'm Raul Almazar. I'm with the National Association of State Mental Health Program Directors. And I welcome you to our second of 3 town hall sessions. For a quick introduction, I think probably many of you have seen the Surgeon General's call for action to address the public health crisis and the devastating impact of the epidemic on loneliness and isolation in the United States. Dr. Murthy explains that disconnection fundamentally affects our mental, physical, and societal health. He also states that loneliness and isolation increase the risk for individuals to develop mental health challenges in their lives. Through funding from SAMHSA's Transformation Transfer Initiative, NASHPID has partnered with peer-run and community-designed initiatives to serve diverse populations, including those experiencing trauma in their daily lives and individuals struggling with their serious mental health challenges. So this town hall series hopefully provides an opportunity for discussion and implementation of the 6 foundational pillars outlined by Dr. Murthy. We had our first session that talked a lot about the work that's happening in the faith-based community. And today we're going to talk about peer-run programs. And really the reason we brought this forward is that as we talk about people needing help, maybe even in crisis, that we're able to look at not just traditional mental health models, but more community initiatives, especially around not just providing mental health assistance, but really helping with the connection, establishing connection and reducing social isolation. So we are thrilled to have wonderful presenters today, and I'm thrilled to introduce Shireen Allen Caraco, our moderator for today. And with that, I will just have to say, please feel free to enter questions, comments in the chat as we go along. We will have a pretty involved conversation probably towards the second half, and during that time people can also unmute and ask their questions or comments in person. So Shireen, take it away.
Thank you so much, Raul, and thank you to NASHPID for creating space for this very timely conversation, town hall dialogue that we're going to have about isolation, loneliness. How do we create connection? And I'm going to introduce you to some leaders around the country that are doing just that. I want to start off by saying my name is Shireen Caraco. I am the moderator for the conversation. I am the CEO of an organization in North Carolina called Promise Resource Network, or PRN for short. And our entire reason for being is to do exactly that: decrease isolation and loneliness, increase connection, increase hope of people that have been impacted by a variety of issues, from significant trauma to labels of mental health issues to substance use challenges and overdose, to people that have experienced long-term houselessness and folks that have experienced incarceration. And we do that from the vantage point of lived experience. So all of our team members have been directly impacted by the very issues that we are supporting people to work through and to transcend and to heal from. So I'm so glad to be here and be able to introduce this amazing group of people. As Raul said, there was a U.S. Surgeon General's report that just recently came out. And if you haven't seen it, I believe that we put it in the chat. And there's a couple things that I really want to call out from what that report says. First of all, it calls isolation and loneliness an epidemic. So that's a big word, right? That's a very bold claim and a very bold statement to make. And for those of us who are in community that are intentional about combating loneliness and isolation, this is something that we have known for many, many years. We see it every single day, and we see the harmful effects of disconnection on our own emotional well-being, as well as some other things. So the fact that this came out validated, for me, I'll just say for me, I don't want to speak for the other speakers, but it validated something that we have known for a long time, but needed to be named and needed to be called out. So I really was very appreciative. I saw a collective sigh and questioning from my community about that report. So people that aren't connected to it every single day said, oh my gosh, like, first of all, that makes complete sense. But secondly, I never really thought of it in those terms. And just to call out some of the numbers. So Dr. Murthy had cited that over, I believe it was half of the US adults reported measurable levels of loneliness pre-pandemic, right? So this is before we literally disconnected as human beings and disconnected from our routines and may have disconnected from our jobs and could no longer see each other. Half of US adults reported measurable impact of loneliness before the pandemic. And what they did was create a connection between loneliness, isolation, and disconnection on a variety of different things. So I want to read you a couple of the data sets. Number one, it has a significant increased risk of experiencing mental health challenges. So whether that's anxiety, whether it's depression, whether it's panic, a variety of things that get labeled as mental illness, we know that disconnection and loneliness cause it and or contribute to what ends up getting labeled as mental health issues. Secondly, it increases heart disease by 29%. Isn't that interesting? So we're seeing not only the emotional health and well-being, but the physical health impacts. It increases your risk of stroke by 32%. Imagine that. Isolation and loneliness increases stroke, that percentage. 50% increase of risk of dementia. And this is a staggering number. 60% increased risk of premature death. All related to isolation and to loneliness and to disconnection. Obviously, this is a significant health issue that we need to be able to understand further. It used to be that we said, well, this is a mental health issue, and you go to treatment and we have programs and you go to services. No, this is a collective human issue that we have to be able to respond at the human level. And we have to be able to find ways to connect within our own community. And so that is sort of the setup for the conversation, the dialogue that we're going to have today. I have three amazing guests with me today who are leaders in their own community. And I'm going to start just by having them introduce themselves if they would. And then after that, I want them to talk about what they are doing in their community to be able to address this issue of isolation and loneliness. So can I start, Vesper, with you? Would you be willing to introduce yourself to the group?
Absolutely. Hello, everyone. My name is Vesper Moore. I am the Chief Operating Officer of an organization called the Kiva Centers, a peer-run organization in Massachusetts. I'm an Indigenous person. I'm also a survivor, a trauma survivor, psychiatric survivor, and I'm excited to be a part of this conversation.
Thank you so much, Vesper. And Rich, would you go next, please?
Hello, everybody. My name is Rich Hollett. I am the Division Director of Recovery Support Services for Lowell House in Lowell, Massachusetts. So all my programs are peer support services. I am a person in long-term recovery, as are all the people who work within my programs. So one of the programs is Recovery Cafe Lowell, and I'm soon to open up another one, Recovery Cafe in Haverhill, Massachusetts. It's good to be here.
Thank you, Rich. It's great to have you. And Mary Ferreri, will you introduce yourself, please?
Sure. Thank you, Shireen. I'm Mary, and I'm the founder and CEO of Emerald School of Excellence, which is a recovery high school in Charlotte, North Carolina, the first in the Carolinas. And I was an educator before opening Emerald, and also have had some struggles in high school. So I'm actually in recovery from an eating disorder and some other struggles, and just grateful to share my perspective and experience. And thank you for allowing me to be here.
Thank you for joining this amazing group of people. So we're going to uplift 4 different approaches that we are using in our own communities. One, as Mary said, is Recovery High School, and we're going to end up starting with you, Mary. The second one is Recovery Cafe, who Rich is going to represent what that is. And then Vesper is going to talk about peer-run respites, and I'm going to talk about peer-run warm lines. And so just to give you a little bit of a sneak peek, Recovery High School, Recovery Cafe, Peer Run Respite, and Peer Warm Line are the 4 different approaches that we're going to center our dialogue on today. So let's start with our young people. Mary, can you please tell us, what is a Recovery High School?
Sure. So a recovery high school is a place that educates and supports young people who are in recovery from either substance use and or co-occurring disorders that are ages 13 or so to 21. And they're here to earn their high school diploma. Recovery high schools are not a new concept. They've been around since the late 80s and really have kind of opened in pockets. The Northeast has had a few over time, California, Texas, and parts of like Minneapolis, but really in such small pockets. And when I learned of this concept, it was through a film called Generation Found, which dove into a recovery high school in Houston, Texas. And the best way to understand really is just to kind of check out not only that film, but then to start to visit. So I visited other recovery high schools and spent some time. Just the beauty of having a space where young people can be supported with tons of Me Too moments everywhere they turn, and have staff that supports not just their academics, but a place for them to heal and have hope again, is what makes recovery high schools so special. I know I would have benefited greatly from attending one if I had had people that either I was, first of all, comfortable enough to talk about what I was going through with, but then to know that when I was doing well or having good seasons of time to be pushed and held accountable for other areas of my life, but then also to be flexible enough to pause and do the next right thing by that person based on their journey. If it meant, hey, academics just need to take a back seat today, tomorrow, this week, then that is exactly what needs to be done. And so to witness that firsthand, and then as an educator or coach, I said, well, shoot, is there one like this in the Carolinas? And so there weren't any, and there never really was, to my understanding, an attempt in the Carolinas to open. And saw kind of the whole Southeast without recovery high schools. And so a mother kind of looked at me, and there was a lot of folks that had a lot of interest in just coming behind the concept and making it possible. So from a nonprofit to then a full-on school, 2019, with 2 students, myself and a person in recovery, we kind of opened the school. And it was definitely a feeling of people kept saying, if you build it, they will come. And sure enough, we've grown from 2 to 8 to 15 to last year we had 30 students, graduated 17 last year, biggest class, and have over 28 alum now. And of course, as you can imagine, like we're trying to almost build a giant family. And that's what's so beautiful that I've gotten to experience from the community of recovery, whether it be from a mental health struggle or substance use. Just the community at large of recovery is so stinking awesome and welcoming and a forever home. And so that's what I wanted Emerald to be, is just because you've graduated, we keep coming back, and we have folks coming to serve, to volunteer, who graduated and just want to still be a part of what's happening for the next group of leaders and graduates. And so what's really powerful is we bookend the day. We start the day with recovery support and peer support and end the day that way. And of course, it's mixed in between as needed for each student. But that's to let them know we care about you first, and the other stuff will fall into place when we feel good. And it allows us to have an open, be on the same page, immediate understanding of where each student is, to support the teachers, to support the students, and also for the recovery support team to just be ready in action for who needs extra support, love, and care, or who may try to take advantage of the love and care, and we can hold them accountable. So it's that wonderful balance we get to practice with young people. And even if they tell you out the gate that they don't appreciate that, that's exactly what they end up saying they're grateful for, because at the end of the day, that's what they need. But I just say I'm grateful for the local community, because we as a organization couldn't function like without support. So it's always about extending our not just awareness and education of what recovery high schools are, but how we want to serve the community and be available to help others in our community, to support young people, or let us be an outlet to help connect resources. We've learned so much through PRN and Shireen. Like, truthfully, it's trying to create almost a young people hub of support, because it's so much bigger than just the get your diploma and get your grades. Like, we're so much more than that. It feels almost sometimes like we're just not. That's a piece. It's a small piece. But I'd say each student here gets a customized experience. We want them to help redefine what their future and success looks like. It's not some kind of created square box that I feel in our educational system has gotten smaller and smaller, and less folks fit into that model. And instead being like, you need to be a part of that process. You need to be able to explore and create constantly, so that you can start to discover a lot and feel so confident in your abilities to really do anything. But from that bar that started getting set lower and lower, they're all that often surpass what they thought they could do, just because they start to believe in possibilities again. And so that's what our customized individual programming looks like. To give you a small example, if students come in and we find out their interests might lie in music and they want to take a piano class, well, I don't know how many schools any of us have really attended where you could walk in and say, so I want to take piano classes or lessons, and can that be counted as an elective credit? And it'd be like, yeah, I don't think so. We're not just going to get one teacher for one or two students. Well, due to the love and support that people pour into Emerald, we get to do that all the time. And now we have this big pool of folks that we can reach out to come teach piano, come teach guitar, inspire some interior design. And that's the beauty of it, because when students feel, or anybody feels loved and heard, and then you deliver for them as if they are the utmost priority, and that is just genuine. It's not for any other agenda, but that, like, I care about you, and I want to be able to do this so that you are inspired and have hope for today and tomorrow, and that's really it. Goes a long way. And it's not complicated. It's really quite simple. And that's what's also beautiful, is that we do the same type of stuff we do for our students, we do for our staff. So we've built in mental health Fridays. We've made half days for every Friday throughout the school year. Because we're private, we do charge tuition, but we are scholarship left and right, partial, full, and we haven't had to turn anybody away due to financial need. And that's my goal, is to always have ongoing support, so that we're just a big giant community helping to increase enrollment, and then one day be in pockets, just like some folks will say they're spreading their arms and wings throughout the state. I'd love to see a day when recovery high schools are scattered all around the country. But at Shireen, let me know if there's anything else in particular.
I have two quick. One is, do you know how many recovery high schools are in the country right now, or an estimate?
It hovers around 40, mid 40s. Mm-hmm.
And the second is, if these young people weren't students at a recovery high school, where would they be?
Great question. So they're coming to us from majority public school systems, but some are from private, charter, Montessori, you name it. They are coming from all different places. And of course, because we're the only one in Charlotte, folks coming to us north, south, east, west, they're traveling up to an hour away. And even in recent time, folks are moving up to 2-3 hours from their current location to come to us, since there aren't any.
So you're going to hear me say this over and over and over again in our town hall. So I hope you don't get sick of me saying this, but I'm going to say this for every single one of these. If you have never had the opportunity to go to recovery high school, please look at where your local recovery high school is, or the closest one to you. Because when I tell you, it is an experience that you have to be surrounded by to understand. It is part tailored academic, so experiential academic, as well as didactic academic. We actually had a group of students come and do a national webinar, and to a student, they said the love that they receive at the high school makes all the difference, but it was the connection, the peer-to-peer connection amongst each other, but also the connection that they have to the teachers. And I asked them hard questions, like when you say you can be honest and open, so if you're thinking about suicide as an example, would you go to a teacher and talk about that? And every single one of them said, absolutely. But you're not afraid that you're going to be hospitalized? Every single one of them said, absolutely not. They're going to have those conversations and we're going to work through it and we're going to talk about it. But this is a place where I feel open to be fully who I am in the moment, every single day, feel connected, no longer feel alone or isolated or like I am the only one, and be able to step into my greatness. That part of it is my word, not theirs, but I will tell you, they are all working as emerging leaders. And it was really quite remarkable to be able to experience them. I get to go to the Recovery High School, so I will say I'm also very biased. But I promise you, you will not regret it if you go and check out what a Recovery High School looks like. Thank you so much, Mary. We will get back to you with more questions after everybody gets a chance to introduce what they do.
Thank you.
You're welcome. Saying that, Vesper, tell us about peer-run respite in particular, although I know you do so much more than peer-run respite, but if you could start with that, that would be great.
Sure, absolutely. So peer-run respites are an alternative to hospitalization, or sometimes they can be utilized as another space after being hospitalized or as a way of preventing hospitalization. And peer-run respites are run by people with life experience to support other people who are navigating sometimes very difficult circumstances related to their mental health. They could be coming out of jails, they could be coming out of prisons, they could be coming out of psychiatric acute units, they could be coming from the streets while they're struggling emotionally, they could be in school, they could be at home isolated, as we're talking about today. And for us, our peer-run respites, we had just started opening them in 2021, so we're 2 years strong. We've opened 2 so far, we're working towards our 3rd. And we have one in the 2nd largest city in New England, which is interesting because Worcester, Massachusetts, you wouldn't always think about it as like such a large city, but by population, it's very large. And we have a peer respite there called Karaya. That's a 6-room house. And, you know, we often say home-like environment for peer-run respites. This is very much a house with colorful art, you know, designed by the community, rooms that are, again, designed by the community, and the entire thought process of everything that goes into our spaces are designed by our community, and we work together. Karaya is an indigenous concept. It means moon, the moon spirit for the Taino ancestors. And the reason why we went with Taino ancestry is because a large majority of our community is Hispanic, Latine, and Taino are the indigenous people of Puerto Rico and the Dominican Republic. So I think when we talk about culturally responsive space, that's another essential element. But moreover, what's unique about peer-run respites is that people manage their own medications. They come into these spaces and they kind of determine to what degree they want to engage or be involved. There are peer support groups available, but there's nothing that's mandated, and people can come and go as they please. Now, a lot of people would think, oh, well, if someone's in emotional distress and they're a danger to themselves or others, would you have them in an environment where they had a lot of that autonomy and control? Isn't that too much in terms of liability or risk? And that's why we focus on a dignity of risk. We actually talk a lot about a person's right to have that self-determined aspect, and whether or not if that's a good fit for someone, you know, it kind of differs person to person. But more often than not, as folks join in our space, they get involved in our community, they find that, wow, okay, so people have gone through similar experiences as me. They're not going to judge me. There isn't this aspect of stigma or discrimination that's as prevalent. And people seem to open up and feel more honest about connecting in moments of distress. There was a study done by the psychiatric the Psychiatric Rehabilitation Journal in 2007 that said that peer-run respites reduce hospitalization rates by roughly 57%. And I think that's such an incredible piece, but yet we see peer-run respites in 14 states, right? And we see, like, I believe there's close to 30 in the country. Shireen's probably got a better number, but as I see it, there's this effective model, right, that is run by people with life experience, and we've seen support for so many people who have been hospitalized and isolated throughout the COVID-19 pandemic these last few years. We've supported roughly 800 people. I believe it was like 750 last I checked, and it's been a few months, so I'm estimating roughly 800 people. And those supports have been really critical. Another component to our peer-run respite is that we do mobile peer respite. So we go to people and we support them for up to 4 hours at a time, whether if that's at their home or at a cafe or in other spaces. This is a very unique model that we've kind of implemented in addition to our peer-run respite. We have another peer-run respite in a more rural area called Juniper. It's a 4-room house. It's in Bellingham, Massachusetts. And what's unique about Bellingham, Massachusetts was that we found that there were barely any mental health services in that area. So we were like, wouldn't it be great if we put a house right here? And it's like right in between Worcester and Canton, which is such a large region of Massachusetts. And we've actually found that by being involved with that community, having people go on hikes together, check out the community spaces in the local neighborhood, leading fully integrated lives in the community in those moments, we've really found a better capacity for healing along the way. And then we're going to be opening a third peer respite in Dudley, Massachusetts. It's going to be called La Paz, which is Spanish words for the peace. Primarily in that area of Massachusetts, most of the people that we support are Spanish speaking primarily. So we've been hiring employees who are Hispanic, Latina. We hired a program manager who's a housing specialist and speaks Spanish and English. And we just hired someone else who speaks Spanish and is fluent in American Sign Language. So we've been really focusing on these cultural approaches and really expanding in that way. Something that is unique about our peer-run respites is that because people have that self-determined plan in that moment in time, and they work with folks in our community at these peer respites, they can continue to receive peer support in the community at our recovery learning community. They can continue to receive support from our peer support line. They can continue to receive support on our online peer support groups, or they can become trained as a peer supporter if they want to give back to their community. So we've built this sustainable ecosystem in Massachusetts, and we're trying to replicate it across the country. But yeah, that's our overview on peer-run respite.
I got so excited I was talking while still on mute. Okay, I have to ask you $1 million question because I know it's a question you get a lot. It's a question that I get a lot because we also operate a peer-run respite through my organization. But here's the question. Guests that come to your respite are experiencing significant distress, right? They may be incredibly disconnected from other people. They may have thoughts of suicide. They may even have a plan around a suicide. They may be engaging in self-harm. All of the things that historically what we have been taught from a traditional system is so dangerous that people need to be confined. They need to be forced into a locked space. They need to be in a locked space to protect themselves from danger and protect other people from safety issues. And you're talking about an environment that, number one, they're not clinicians staffing it. It's people with living experience, so people that have experienced their own level of trauma, mental health crisis, who may have been hospitalized themselves, maybe suicide attempt survivors. So it's not clinically staffed. And number two, it's unlocked. So you're talking not only about people being able to come and go, but the environment itself is not locked. I've been to Juniper and I've been to Cry. I've been to both your peer-run respites. And it is literally a home in a neighborhood, in a community. How do you explain to people how you maintain and honor safety in an environment that is so opposite of what we have been taught and trained is required? during significant disconnection and distress?
Well, I think first off, a culture of mutual respect and connection around safety is the first point of what we establish. So usually when we speak to folks, like, yeah, if folks feel in that moment for whatever reason that they don't feel safe at that respite, they don't feel safe anywhere, or they themselves feel like someone who could, in a lot of ways create an unsafe situation, usually we know ahead of time because we've had this conversation ahead of time. And more often than not, I've found that when you have an environment that is of respect and warmth, that is led by a community, that you have better social outcomes. So something that's very important to our model is that we believe that environment matters, and that the presence of positive messages isn't as important as the absence of negative messages. When you have one sign that says you are a flight risk, followed by another sign that says, have a great day, I'm not hearing, have a great day. I'm hearing that I'm a flight risk. So messaging is really important. The environment's really important. And another big component is that when you establish this relationship in a reciprocal way ahead of time, more often than not, if someone is in a situation where they're like, yeah, I might do something, they'll feel more comfortable talking about it. Just like we were talking about with the recovery high school, because that rapport, that relationship is already built. So I think that that's something that is unique to the peer support model in a lot of ways, in terms of transparency, reciprocity, and connection at the center of the work, social connection.
Again, you know what I'm going to say, if you've never had an opportunity to go check out a peer and respite and you have one nearby or someplace that you can travel to and they're willing to show you what a respite is, it's one thing to talk about it and try to describe it. It's really hard to capture that type of environment. It's something that you have to walk in and experience the difference and what makes it so incredibly healing and so incredibly unique. Based on research around the impact of peer-run respites, including health outcomes, recovery rates, return on investment, just amazing quality of life impacts around respite, we are finding that around the country and internationally, peer-run respites are becoming prioritized in different states and in different communities. At the federal government level, there is a recognition that involuntary treatment and confinement is actually perpetuating trauma and harm to folks, but there are no alternatives without alternatives. And a peer-run respite is an alternative that is intentionally a healing environment where, just as you said, Vesper, and just as you said, Mary, if somebody's experiencing distress, they can express it without fear. And that is part of what creates safety, is we talk about it. We talk through it. We are honest about it. We support each other through it. We don't just hide from it, either pretend that it doesn't exist or just try to fix it, right? Or send you someplace to, try to make it better. We have courageous conversation and we are in intentional relationships. So thank you so much for that, Vesper. Yeah, please roll.
I have a ton of questions for Vesper, but one quick question. How big is your peer-run respite that you run in North Carolina?
So sure. Vesper is Mass. I'm in North Carolina. Why don't we start with you, Vesper?
Yeah, yours, Shireen. How big is your peer-run respite?
So right now we have 3 guests. We are expanding and we are going to have 6 guests really in the near future.
Thank you.
We intentionally keep it small because it has to be a healing environment, right? Great question. And Vesper, do you want to say the same thing about Juniper and Karaya? Do you want to talk about the size?
Yeah. And I think that's a great point, Shireen, when you stay small and to maintain an intentional healing environment, because it depends on, because as you grow, something that you'll notice is that people are connecting less, communicating less, and you have to foster that communication as you grow. Like we've had to come up with so many different innovative strategies to just maintain that connection, that training, and all of these as we've grown. But yeah, one of our houses, our Karaya Peer Respite, is 6 rooms. So we usually have 6 people at a time. We do 7 mobiles associated with that house. We see people like 7 people at a time in the month. And then in Juniper, we have 4 rooms. So we usually have 4 people at a time. And then with that, I believe we see 9 people in the community at the time. And then with our new place on Dudley or La Paz Peer Respite that's opening up, that's going to be another 4 room. So it'll be another 8 people in the community. And a big piece of it, to Shireen's point, is centering training, community. Something that's great about a lot of the people that work at our peer-run respites are that they were facilitators in our community. They were actively involved leaders in our community. They're already a part of the Kiva Center's community and ecosystem, if you will. So when they start working at our peer-run respite, they're already so embedded in our community and so connected. So that's important in terms of fostering those healing environments.
Thank you so much. I also want to come back to Mary before we meet Rich and talk about recovery cafes. In terms of the size, right now you have 35 students, right? You started with 1 or 2 students. Imagine a high school with 1 or 2 students, everybody. It's really something to experience. But you now have 35 students, but you have said to me, I am capping it at a certain number of students. What is that number, and why is your intention to keep the recovery high school relatively small?
So for the same reason to keep peer-run respite small is so that quality of support and that ability for our staff to keep class sizes 10 or less, for us to feel like a family, for everyone to feel like they're heard and there's opportunity to do that with excellence and really well. The largest recovery high school, which is the documentary that they filmed off of Houston Archway Academy, they have gotten to in excess. They've surpassed 100, 125. When I asked that director though, what was the sweet spot of the best ideal number, she said, Mary, 75, 80. You start getting bigger than that, it is very difficult to have that intimate, quality, customized learning experience. So that I just landed, I will never exceed 100. If I can steadily have 75 to 80 students enrolled every year with our graduating class and then filling in those gaps, that's to me the dream. But most recovery high schools across the country, if you look up enrollment, are less than us, and we've been in existence for only 4 years. Many hover in the teens, sometimes hit a 20, 25. So it's more rare than anything to even hit that 75, 80, but I do think impact is possible and great still at that number, but that's our goal for the Carolinas.
So that's really helpful. I know a couple of folks have had their hands up and they're in the chat. Can you make sure you remember your questions? I want to make sure we introduce Rich. I know that you're all going to have a bunch of questions about each of these, but I also want to point out what Mary and Vesper you're saying is there is a push within mental health, what I call big box Walmart mental health, right? Where you become huge, you do everything. You have to have a variety of services that you provide, and these organizations become very, very, very large. What both of you are saying is that you are intentionally right-sizing it to make sure that there is tailored support, that there is intentional connection, that relationships are not just wide, but they're deep, that you are creating a culture that is done purposefully, and that culture is done around healing. But it sounds like size becomes a factor for both the peer-run respite as well as the recovery high school as one of your active ingredients. So I just want to point that out, that, you know, we have a lot of pressures to do more, become bigger, bigger. But one of the things that we have realized that are kind of tried and true in community is connection is critical, right? And having those individual relationships are critical. Okay, so Rich, we're going to have a bunch of questions after you. I know we are. But I want to make sure we get in recovery cafes. You all know what I'm going to say, right? You have got to go to Recovery Cafe in order to understand what Rich is going to describe. So if you have an opportunity and you have a Recovery Cafe near you, please go check it out to be able to get a context for what Rich is going to say. Take it away, my friend. Describe what a Recovery Cafe is.
Thank you very much. And I appreciate you saying that before me, because it's true. You really do have to experience it to fully grasp it. However, having said that, everything about the Recovery Cafe is based on the truth that all human beings have equal, immeasurable value and potential, regardless of all things, including mental health issues, substance use issues, homelessness issues, re-entry, criminal justice involvement issues, or just past mistakes made. So everything we do is done around that premise, including the design of the space. We want anyone and everyone who walks into a recovery cafe to feel a warm hug, to feel as if they're not only tolerated, that they're celebrated. So having said that, we do function by some. So we have the Recovery Cafe in Lowell for starters, and then we're soon to be opening one in Haverhill, which is about 25 minutes away. And we have all recovery cafes also designed to be as low barrier as possible. So free, no insurance is involved for any of the recovery cafes. And we have membership requirements. So the membership requirements for the cafe is 24 hours in recovery, to participate in a weekly recovery circle, and to give back to the community. So I'm going to go back to the 24 hours in recovery. Every day here at our cafe, we have someone who comes in who's under the influence of something. We don't necessarily, so that philosophy about conveying value to everybody who walks in the space is still intact. We don't punish them. We'll bring them out a cup of coffee. We'll plate them up with some food. We'll give them a hug. We'll walk them around the corner to visit a recovery coach who can connect them to a detox. We'll just meet them where they're at, as lovingly and as committed to seeing the value and potential in him or her, regardless of how they're presenting. And that, I'm sort of stressing that because the more we do that here, the more we see the value of it and the benefit by it. To just have someone loved in sort of the throes of their worst moment, you may not see it, come into fruition in that exact moment, but I do see it every day. Those seeds get planted and good things happen. We also have guiding principle. Another one of the requirements is to follow the guiding principles, and the guiding principles, I'm going to read you the Recovery Cafe Network guiding principles. The Recovery Cafe Network, which consists of 61 recovery cafes throughout US and Canada, largely US though, they're insightful enough to know that each one of the cafes is going to adapt to its own population demographics, and so there's flexibility within the model. But the guiding principles are: connect with divine love in ourselves and others, show respect, cultivate compassion, practice forgiveness, encourage growth, and give back. We are also part of the Recovery Cafe model is the School for Recovery, they call it. Again, each region's recovery cafe is going to look very different. Ours is, which I'm sure others are too, very member driven. We function almost by like an upside down hierarchy. Really, I forget who said this, but someone said something about, Recovery High School. Someone wants a piano lesson, they make it happen. When we first opened at Recovery Cafe in Lowell, we have a community meeting every week. So we ask people what they're looking for, what their interests are. Because we want it to be a highly engaging experience. It's not a drop-in center where people come in and flop down and watch TV. The TV doesn't even go on unless it's something of special occasion. But a lot of, in the beginning of the community members that we had, people were asking for a lot of musical equipment. So, keyboard, drums, guitars, which we got right away for them. We've since had teachers come in, volunteer teachers come in to provide lessons. Right now, someone just asked for yoga, which we've had in the past. But so what the programming looks like every month is different, and it's dependent on the current membership. it can be, we have a lot of art stuff going on because people are expressing interest. We're soon going to have yoga again, meditation, walking club. We just started a fishing club for the 3rd year in a row because those same people that wanted it are still here fishing. Let's see. Sorry, I didn't fully prepare for this. I didn't know we were actually doing it.
You're doing great, Rich.
Oh, thank you.
You're doing great.
Well, you know what? I'm gonna get a little personal here to make it, give it a little spin. So we opened January 2020. So we were only open for 6 or 8 weeks. And when we first started, there was, you know, the original 4 staff. We were new to the model, new to running a peer recovery support center, all with lived experience, all compassionate. We have a large homeless population in Lowell, and we knew we were going to have sort of an onslaught of interest. And we did. We had like 80, 90 people in here a day. Not many of whom weren't following the membership requirements, but we were new. We just wanted everyone to be okay. We broke a little away from the model just to be kind to these people. And then we realized, you know, we learned a lot in the very beginning. We learned a lot. We realized, okay, well, these, you know, they're homeless. It's January, it's freezing. Let's let them relax, let them sleep. You know, within the first 24 hours, like, we don't know if they're sleeping or overdosing. This is not good. So we obviously had to lean into the model in terms of the 24 hours sobriety. And we don't do any testing here. We as the staff are just able to determine it from our own lived experience. And if there is a question, we err on the side of the member. But so the longer time went on, the more we really got good at the model, and it sort of revealed to us how awesome it is. And we were so committed to being kind to people no matter what, even when we weren't able to allow them into the space, we were making sure we were still conveying the value and potential within, and treating them with love and respect and kindness and generosity, and giving them food and giving them hot coffee. And even that alone has impacted not only the members that we've done or the community that we've done that with, also other providers. One of my favorite things about the Recovery Cafe model is they understand that people, and I'm speaking in some ways from my own personal experience, not just with addiction, but with treatment. Like, if, you know, we have these guiding principles, other treatment centers have their own rules and regulations, and they're important to follow. However, if the people were at the place where they could follow them, they probably wouldn't be in that environment. So instead of being punitive and kicking someone out, which these days the cost to that has risen, they could overdose. So the Recovery Cafe has taught us to create an experience with those individuals. We want to hold them into love, in loving accountability, but provide them with the experience that gets them to the point where they understand the value of following the rules, not even necessarily for my sake as the director, but for their own sake and for the community's sake. So that's probably one of my favorite principles of the Recovery Cafe model, is just no matter what. And we've had some pretty crazy things happen here in the Recovery Cafe, you know, people stealing and people fighting and people selling substances, and we've never kicked anyone out, you know, never permanently. We have given people a break for a little bit of time, although that's only happened once. But just the value of meeting people where they're at and loving them regardless of that has proven repeatedly to have its rewards for people. And so the weekly recovery circles are also another way to, you know, people they experience a connection within the Recovery Cafe, the Peer Recovery Support Center itself. But the weekly recovery circles are intended to hold each other in loving accountability. In some ways, it's just a check-in, but it becomes a very intimate environment. People have to attend the same one weekly. And it's where people sort of show up and, you know, they come to know each other's recovery, and they, you know, someone says, you know what, I got to reconnect with my family. I'm going to call my mother this week. The following week, the members will check in with them. Oh, did you call your mother? How did it go? And it's a really beautiful thing, because again, the bulk of it is directed and driven by the people, by the members. And it's just like the model, the Recovery Cafe model makes me a better person every single day. It's so easy to default to judgment and intolerance. And the model has sort of, I feel like we've all created a new neural pathway to love more and to, because we're following the model.
Rich, can I ask a question?
Sure.
Is it an actual cafe? Like when you think of like
That's a good
a
question.
coffee house, is it an actual cafe?
It's sort of set up that way because we have this really awesome latte machine or espresso machine. But in some ways, I feel like I might get my hand slapped by the network for saying this, but in some ways, the cafe component, the cafe, it's almost a little gimmicky, but in a really beautiful way. Like people can come in and they can learn how to make espresso, and theoretically they could go out and we could provide our barista training program, which we do. They could go out to Starbucks or Dunkin' Donuts and get a job there. And that's beautiful and that's important. But there's so much more to the model. It's really not a cafe per se, although some people do walk in here thinking that they're going to sit down and have breakfast served. That happens pretty weekly. No, it's not. It's a peer recovery support center.
Okay, thank you so much. Thank you, Rich. You actually painted quite a picture. I'm going to round out by just talking a little bit about a peer-run warm line. I'm just going to give you this much because I know this is a lot, right, to absorb. So peer-run warm line. We operate a peer-run warm line at our organization. It is operational 24 hours a day, 7 days a week. People can call as frequently as they want to combat disconnection. So people call for a variety of reasons, from I lost my job to I'm starting a new job. I'm having trouble with a landlord to I am having a problem with my loved one, to I'm thinking about suicide, to I'm really overwhelmed and anxious. Every imaginable reason for people to need connection is why they call a peer-run warm line. We opened our peer-run warm line 24 hours within the lockdown of our state because as survivors ourselves, we know the impact that disconnection has on overdose, on suicide, on interpersonal violence, and on risk, right? We know the impact. We are all survivors of that type of disconnection. We opened our peer-run warm line thinking, if you all remember during COVID, maybe a month. A month turned into 3 months. 3 months turned into 6 months. 6 months turned into a year, and that turned into 35,000 callers to our peer-run warm line. It is not small. It is very heavily utilized to this day. People call the warm line for a variety of reasons. The person that they're talking to is another survivor. It's somebody who has been through it themselves, who have been specifically trained in trauma and a variety of other peer-to-peer support type of approaches. And there is no topic that is off limits when you call a peer-run warm line. Every state, I cannot emphasize this enough, every state needs peer-run warm lines. If people had access to peer-to-peer support 24 hours a day, 7 days a week, to just work through distress, it is amazing what we would see in terms of impact on hospitalization, on involuntary commitment, on suicide rates. People call because they know we're not going to involve police. We are not going to involve mobile response, and we're not going to have them hospitalized. So they feel very comfortable and free to call for a variety of different reasons. And it is confidential. So my hope is that we see peer-run warm lines all over the state as a part of our response to combating isolation and loneliness, because it needs to be one of the basic fabrics of how we are connecting human to human so that we are not so isolated and disconnected. Okay, I know that's a lot, everybody. the beauty of it is there's so much going on in our communities, and it is remarkable. Chris, you had your hand up, so I am going to call you first and say, please ask your question.
Thank you, Shireen. My question was to, I think, Vesper and also Richard. Vesper, what is the ratio of peer support specialists to guests at your respite?
So we have peer respite advocates. We usually have a person who's working the shift. We have an on-call supervisor, and we have a mobile person. So essentially anywhere from like 1 to 3 at a time.
Okay. And is your supervisor also a peer?
Yes.
Very
We're a peer-run organization. So our
Wonderful.
executive director, myself, our board of directors, we're all people with life experience, survivors.
Awesome. Thank you for that. Really great program. And Richard, I was wondering, what's the general, I don't know, customers you serve today, for want of a better word, guests you serve a day, and what is your ratio of peer support staff to folks you serve?
We're about between 300 and 350 a week now. That's our average, and it changes season to season. We always try to sort of identify why the numbers are changing. We never get it right. It just seems random. And so the entire staff at Recovery Cafe Lowell we're all peers. However, our hosting agency it's a treatment and recovery. It's Lowell House Addiction Treatment and Recovery. So yeah. Does that answer your question?
Yeah. What's your staff size for that?
We're going from 4 full-time staff. The funding has allowed us, as of July 1st, to have 7 full-time staff.
And Vesper, did you get a chance to answer the question, how many staff are on each shift? And how many shifts you have at your respite?
Yes. I didn't mention how many shifts we have.
Okay.
We have 3 shifts. We have usually like one person at a time with a supervisor that can be present, and a mobile person that can also be present if needed. Great.
And Mary, same question. How many teachers do you have versus peer supporters versus mental health and substance use? I know, I see you doing the math in your head.
So right now we have 8 full-time staff members, and it does vary just based on our enrollment. At the largest, we had 8 full-time and 6 part-time. And that just varies. I'd say there's the 2 admin, there's 4 to 5 teachers full-time, and then usually somewhere between 2.5 recovery support staff. And then depending on the level of funding and or enrollment, we could have up to 5 or 6 part-time teachers coming in for the piano, the guitar, and the art and all that stuff.
Perfect. Vesper, you sent the link for the citation for the 57% reduction. So thank you for that. There is also, I don't know, Vesper, if you can send the link for all the peer respite studies. If you have that handy, that would be great. If people want to see the different research that's been done, that would be great. There is a question for you, Rich. If you can send out or share in the chat the list of rules that you're referring to. So the agreements that you have as a part of Recovery Cafe would be great if you can send that out.
I did list them in the chat.
Perfect.
Membership.
I'm playing catch up, my friend. So thank you for.
Okay.
You all are keeping up to date with the chat really well. Let's see. So a lot of kudos to all of you. All right. So anybody that's checking the chat, am I missing? Oh, is it the same staffing pattern, evening and overnight hours? So the high school is not overnight. The Recovery Cafe is not overnight. So I'm going to assume that that's a question for the respite and perhaps even for the warm line. So Vesper, for your respites, what's the staffing pattern look like overnight?
So for overnights, we have a part-time person who can also join. And I should have also mentioned that we have a relief person on call as well. So if in the event that there's an emergency and the staff has to step away entirely, we do have someone who can step in at a moment's notice. So, but yeah, usually it's like we do like 1.5 FTE full-time employee for overnights.
Perfect. Thank you. At our PRN respite, we have 2 people on at all times, 24 hours a day, 7 days a week. On our warm line, we have 3 people on at all times, plus a supervisor. We are in the process of perhaps expanding our warm line. And if that's the case, we're going to have at high volume times, 4 to 5 peer supporters on at all times, and 3 to 4 on at lower volume time. So it's not a small, neither one of those programs is a small effort. Any 24/7 program, as you all can imagine, is a pretty big lift. So this is a great question, Fabiana. Wait, where did it go? This one came from Neely. How much lead time did it take before these programs became a reality?
Shireen, can I add to that as the bureaucrat? To add to that question, do any of these programs require licensing?
Great question. Okay, so 2-part question. What was the time leading up to it becoming live and launched? And does it require licensure? So who would like to go first on that?
I'll go first. So yeah, we are a licensed agency to do all this work. And basically what we've done is we've taken an existing master service agreement for a blended capacity Model A respite, and we've staffed it with people with life experience. And we've changed the documentation requirements, and we've changed a lot of the existing requirements, and we have other agencies as clinical consultants as necessary to alleviate some of the additional needs. So, but yeah, we're licensed. We have a person from the state inspect all of our spaces, look over all of our policies and procedures, and every little piece of what we do.
And Vesper, how long did it take you to start your first respite? Would you say from like the idea of idea to launch?
Oh my goodness. I mean, we've been talking about, so there's another peer-run respite in Massachusetts called AFIA, and we had together as peer-run recovery learning communities in the state of Massachusetts, we had put in for more peer respites to be funded. And there was supposed to be one in our area, but that funding never came to fruition. So fast forward like a decade later, you know, what it really took was for there to be such a state of distress, right? Where people were really struggling, where they're like, you know, we could fund more of these and fund more models. So yeah, we've had the idea for a long time, but I would say in terms of fruition and when it came up, it took roughly like a year to get it all off the ground.
Mary, I know you had been working diligently. Oh, I'm sorry. Did you have a?
I was just going to real quickly say, you know, hats off to Massachusetts and South Carolina. I mean, it really, I think, takes real insight and leadership on the state level to be able to fund this. So I imagine that most of your funding for all of these great programs come from the state Department of Mental Health, Behavioral Health, right?
Well, actually, it's interesting. So some of them are state funded. Ours is actually, it's federal funding that is awarded and managed by the state. It's to the Executive Office of Health and Human Services. But yeah,
right. It trickles down like that. It starts out with SAMHSA or whomever, then it goes to the state, then maybe the county, then to you. But it still is, it's a commitment and it's a priority and it's a belief that this is the right way to go. And sometimes you get so bogged down by bureaucracies and what you can't do that we don't even consider what we could do.
That's right. And I would say, Joan, that depending on the state that you're in, it is either going to be an asset for you to seek funding from the state, or it's going to be difficult for some things like this. You know, right? Like what I always say about these type of alternatives is there is an element of risk that goes along with doing this well, that you have to have the right partners that recognize that this is not traditional. None of these things are traditional. And if you are in a state that is going to be risk averse, either risk averse or they were going to try to turn the model into something that feels more palpable to them so they feel safer, then it might not be the right funding source to get the funding from your state. It might be you're looking at a different funding source. Our respite and our warm line is not funded by our state. Massachusetts has a long history, along with Georgia and some other states, of having block grant dollars, and they have strong partners in the state to be able to do that. Mary, I know that you're currently in conversations with General Assembly appropriations, perhaps for Recovery High School, because funding a Recovery High School doesn't really fall into a public high school. It's not really a Montessori. So can you answer that question for Joan about that funding piece, the lead up time, and whether you're licensed?
Sure. So we're classified as a private high school in the state of North Carolina. So we follow all of the necessary guidelines to maintain that status. It does allow a lot of freedom and flexibility, to your point, Shireen. So we currently, and since we opened, do not and haven't had any public funding at all. So it has been quite challenging. And in order for us to continue to grow and expand in the way we would like to, there was definitely a lot of convincing to not fall under an existing umbrella, but try to create a completely separate item in the budget for Recovery High Schools, which I do hope then it helps us become a model for other counties to get funding to do the similar programming that we do. For me, because I was still a full-time educator, it took us 3 years from idea to day one of opening.
I wonder if it could fall somehow under a charter school kind of model.
It in the traditional requirements for charter, not to do the way we do things well, would it make any sense? But if there were an ability for there to be a Recovery High School subcategory as a charter with the state, it's a possibility, but I would probably fight tooth and nail for it to be a very, very specific, separate. Right. It's just easier to just get allocated dollars for Recovery High Schools and make it its own separate category and just be separate from charter, to be quite honest, because there'd be so many things that need to be different.
Mary, I remember when you were grappling with this, and so full transparency, when Mary and I met, you were just imagining a Recovery High School, and you were in the process of leaving your full-time job and taking a risk on this, and people were dangling some money in front of you, and you were looking at charter, and you were looking at Montessori, and you were even thinking about, do we advocate for becoming a part of the public high school network? Like, you were really involved in analyzing all of the different options. And right from the beginning, you and I had conversations about, be very intentional about what it is, what you want it to be, and not accepting funding that's going to change the model. As soon as your model is changed, the outcomes are going to change as well. And what you have to compromise for that may not at the end of the day feel good within your spirit and the intention of why you got into this in the first place. And you have been a great example of a leader that has not compromised on accepting funding for a different variation of what the Recovery High School model is intended to be.
Yep. Thank you, Shireen.
And Rich, what about you? Lead time and licensure for Recovery Cafe?
From first finding out about Recovery Cafe to opening, it was almost exactly 2 years. And licensure, no, for Recovery Cafe. I mean, we do have our hosting agency has all sorts of licenses, but no, it's the bulk of the Recovery Cafes are maybe not the bulk, but many are like church organizations.
For us, our warm line, we opened within 24 hours of our state going on lockdown. I do not recommend it. The only reason we were able to do it that quickly was because, number one, we've been providing peer support for 18 years now. So at that time, we'd been providing peer support for 15 years, 16 years. I can't do math. It's not my strong suit, but we've been providing peer support for a long time, and we had the infrastructure. Second is we opened the first warm line in our state and operated it from 2006 to 2010. Then we had different priorities, closed it down. But when we'd operated it before, it was a time of flip phones. And so what we would do is for every shift, somebody would bring in the flip phone and they would hand it off. The technology is completely different today. Thank you very much. But we were able to open our warm line within 24 hours of that. Our respite, Again, I would not recommend this, but it was about 6 months to launch. I would take about a year in order to start up a 24/7 peer run respite, but we had an urgency in terms of our funding. I can tell you in the state of Maryland for the Baltimore region, we just we're finishing a 6-month feasibility study for peer run respite where we've done a whole environmental scan, data analysis, return on investment, resources in the community needs. We have met with 250 people in that area, and it's culminated in a report and recommendations. Well, that was just 6 months to do that work. It would be at least another 6 months to a year to actually take it to launch. So quick is not best when it comes to doing this well. We want to be really intentional about our planning, and we are not licensed. We do not, our state, unlike Vesper, there is no category in our state for peer run respite. So we do not require state licensure for a respite. All right, other questions that you all have?
I have a ton of questions for any of this in terms of the peer workforce. Do they all have to be certified peer support specialists?
I can answer that. So we do certified peer specialists training in Massachusetts. And I think it's always difficult because sometimes people question, should there be even a professional peer support role? And for us, the belief is that yes, like it's important to have that certification and being able to know how to navigate integrated teams and being able to know how to navigate police situations and being able to know how to navigate all of these things are critical and important. Simultaneously, there's an understanding that there can be a challenge with the professionalization of the peer support role and keeping it away from co-optation and a whole wide variety of things. In our organization, because we offer certified peer specialist training, and we were doing 7 a year, and now we're doing 5, and they're mostly online. And people who usually come into these roles have the peer support experience. They usually are trained as such, but we're not outright requiring it when we hire folks. There are many different pathways to peer support, but it is recommended that they do become certified to have some of those additional skills that are needed for the role.
Rich, do you require certified either recovery coaches, peer support specialists?
So the funders require that the Recovery Cafe staff, the Peer Recovery Support Center, which is Recovery Cafe for us, staff work towards their CAR, certified addiction recovery coach. Yeah.
I have a quick question. What a lot of our work is in congregate settings, whether it's prisons, jails, state hospitals, and we really, when we do our consultations, advocate for peer support in those settings. But that's a place where to get certified is not easy and it's difficult and it happens organically. But we want to be able to make it something that is, a little more customized, a little more robust. So how would you recommend we are able to provide that support, that training in a very different model for folks that are in congregate setting where we know peer support works, but maybe a hospital might have one peer, or it's a very different kind of thing. And that peer is at meetings all the time because they need a peer on this committee or that committee. So the time spent with individuals served is minimal. So what would you recommend for the work that we do in those settings on how to really implement a robust peer support model?
Oh, great question. Who would like to start? I have my own thoughts, but who would like to start on that? What about congregate settings? Jails, prisons, I'm assuming you're talking about federal and state.
We do only state detention and committed, so detention.
And psych hospitals, okay. How do you build a peer workforce in those environments, would you say?
I can say for us, we've trained 18 folks who are incarcerated in Bridgewater State Hospital as certified peer specialists through a specialized program. And keeping in mind that Bridgewater State Hospital is a psychiatric facility that is run by the Department of Corrections in Massachusetts.
Been there.
So you've been there. So yeah. And there is this program, it's called the Companionship Program, that's run by a psychiatrist, Ben Cooley Hall, or Cooley Hall. And we work closely with that psychiatrist. And we've, oh God, it took, I want to say 2 years of really kind of navigating the policies and what was required, but we were able to do online trainings, find secure private space where they could test, where they can take, you know, the course itself and where they could be. We were able to pace out the requirements of their time in terms of like GED programs. We were able to waive the GED requirements for the class. I'm thinking of one gentleman who had survived the killing fields in Cambodia, who was there and could not have access to an education, had a lot of trauma, and you know, it was an essential training, and it took a period of time to waive those requirements, but it was possible. So yeah, I mean, I wouldn't say that there's like one way to do it, but I think it was convenient that there was already an existing program for people who are there in the long term, supporting others to reduce rates of recidivism at Bridgewater State Hospital, and the Certified Peer Specialist program fit that model very well.
Sometimes lawsuits motivate change, right?
Isn't that amazing?
Yeah.
So I'm going to say something that's a little controversial on this topic, Joan. And
What?
I'm going to say something a little controversial on this topic.
I'm shocked.
I know you're really shocked. And I want to preface this by saying this is after having provided, as an agency, forensic peer support for over a decade. So we have peer supporters with felony backgrounds. About 85% of our staff have felony backgrounds that provide peer support in jails, prisons, detention centers, both on the diversion side, the reentry side. And can everybody mute your phone? I'm hearing some feedback. Hope that's not me. Specialty courts. So all the specialty courts. We've been working to build a forensic peer support specialty in North Carolina for many years. Here becomes the caveat of what we have heard consistently. If you have never been in prison, to be a peer support specialist, to support somebody who's been in prison is not shared experience. And many states are doing things like that. So they'll call it a peer supporter who's never been psychiatrically hospitalized or never been incarcerated. Number two, and this is part of the controversial side, is training people while they're incarcerated is great to provide peer support to other people as they become in those settings. But when you start to transition out and you have a certification as a peer support specialist, you are working on your own reentry. So you are in the middle of your own life-altering experience and crisis. So what some people are doing is saying, well, if you get the credential while you're in prison, you come out with that credential. What we have heard and been discussed over and over and over again is you don't have a reentry experience. You have to have actually been in prison, come out and successfully learned how to navigate the over 27,000 collateral consequences of having been incarcerated and come out and be able to do it legitimately if you're going to support somebody in the reentering space. And so there have been conversations about if you're going to do peer support training while people are in hospital settings or in carceral systems, other carceral systems, is that there has to be some sort of tiered system or way to designate that somebody has reentry experience and they can support reentry versus you are providing peer support in that environment because you've been in that environment before. Does that make sense, or did I completely mucky that up?
No,
Makes
makes
sense.
complete sense.
Can I ask a question, Shireen?
Yeah, of course.
Question. I think what you folks are doing is great. This is great. How do you promote or do the outreach to the general community and not just those that would know of you in the mental health community or those, that are homeless? Again, the whole isolation piece, there's a lot of people that aren't connected to so many different agencies.
I would love to answer that, and I'll say a two-part. So one thing, thank you, Shireen, for what you're saying. We've tried to get a lot of different resources in terms of forensic peer support off in Massachusetts, and we've really adapted the Pennsylvania curriculum, and we do some peer support work in the Chicopee Women's Correctional Facility in Western Mass. A lot of people come back out in Central Mass area. It's been difficult, to say the least, navigating those spaces, because often you need a psych evaluation to do the work in that space. So it's interesting looking at that work and a lot of those pieces there. In terms of being embedded in the community and what the marketing looks like, we are a part of our neighborhood association in each area that we are involved in. So in Worcester, Massachusetts, we've hosted our neighborhood association for a period of time. A lot of people, we used to be on Shrewsbury Street in Worcester, Massachusetts, which is it's a very rural white neighborhood. And, a lot of people weren't really sure what we were doing or what the model looked like. And some people were afraid of it, because like maybe people had different ideas about what a lot of these things looked like. But as soon as they came into our center and we got to know each other, and we held that like multiple things can be true at the same time, and that we can disagree, and that we can like really foster these ideas. It went from a neighborhood that was like, get these people out of here, to a neighborhood that was like, hey, you're a part of our neighborhood. You're a resource. You're a valuable resource to our families, to the people that we love. And I think that was important, to be embedded in community in that way. And then in Bellingham, Massachusetts, we've been a part of that neighborhood association as well as the cultural center, and just being embedded in that way. We make flyers, we have our brochures, we do informationals with every psychiatric unit, but we also do informationals in every arts and community center. We do peer support groups and informationals in libraries, coffee shops, barber shops, salons, you name it. We actually train barbers in peer support to do Black run peer support groups and invite people in the peer specialist training. So there's a lot of different ways in which we're embedded in community and talking about peer respite.
Wow, excellent.
So Vesper, would you, since you're doing this online, would you do it outside of Massachusetts if we could get you hooked up? And paid, of course. But would you be willing to think about that too?
Yeah, I mean, we've been doing a lot of informationals, I'd say, online outside of Massachusetts. Like we'll be doing a webinar with the National Council on Independent Living, right? And we'll be talking about disabled run peer run respites, because that's not a thing yet, right? And we'll be talking about all these exciting ideas. So yeah, we are always up for marketing, talking about this, and also how to implement peer run respite. I think that's an important piece. How do you do it?
I'm talking about training like you've done for Bridgewater on peer support. If we could get you to do this, to train folks that are incarcerated or folks that are in hospital to do peer support like you did at Bridgewater, could we get you to do that even though it's out of state?
We would be very open to that. We've done work with the Compassion Prison Project, and we've done some work at Rikers around trauma in the past. So yeah.
Been there too. That's trauma.
Yeah.
No matter what, right? Rikers. Ooh.
I have somebody that I have a relationship with right now, who's actually waiting for me to get done with this conversation, that lived at Rikers for a long time. And yeah, right, that experience.
Yeah.
All right. Are there other questions? I saw a question about neighbor. Oh, good, Ro.
One more. For especially, for peer run and maybe recovery cafes, what do you do about people carrying weapons? People coming in with weapons.
We get this question all the time. Who wants to start?
I'll start because it's an easy answer. We've never had the experience, so we haven't had to do anything about it. We certainly don't frisk people when they come in or anything. We don't even actually, I was going to say this earlier, we don't have cameras in here. Lowell House, my hosting organization, thinks I'm crazy for that. But I'm very much a believer that people respond to their environment. And I think an untrusting environment creates untrusting behavior. So we've had very good luck with it. But yeah, we don't do anything about weapons because we haven't had any reason to believe there are any.
Hey, Vesper, you want to go next or you want me to go next?
Yeah, I'll go next. I want to say also that, like, yeah, we don't check if someone's carrying a weapon with them. You know, it's honestly, it's never really come up. We've had occasions where someone may have been upset and they may have threatened violence, right? And we talk about, like, why were you in the space of threatening violence? And I think similarly to what Richard's talked about, if it's been significant enough, we were like, hey, like, maybe we talk next week, like, and we take a moment and then come back and have a restorative conversation around this, because we do incorporate a restorative justice approach, which means you might be in a specific state of mind where you're talking about these things right now, but that doesn't mean that I'm going to judge your entire character on it or limit you or punish you in this moment. But I do need to exercise what is needed to ensure that this space is as safe as possible. Right. So with that being said, yeah, it's similar in that way where we're not checking for weapons. But if someone is making other folks feel unsafe, we do talk about it and we do engage in kind of a restorative justice approach. And I saw another question about clubhouses. We work with the Genesis Clubhouse, which is an international training center in Worcester, Massachusetts. And we work with Crossroads Clubhouse and a few other clubhouses. So I'd be willing to talk more about that later.
And for us, we expect that people are going to have weapons because we work with people that are living on the streets. And so that's how, that's how people survive and protect themselves. We have had everything from brass knuckles and nunchucks to swords and knives and shanks and guns and yet we're a safe community. And part of the reason why we're a safe community is we know people are surviving. I wish we were downstairs. We have a sign that says this is a safe place. No weapons are needed here. So we don't do the no this, no that type of thing that conveys to people that we think that you're unsafe. No weapons allowed. We don't do that type of thing. What we do is reinforce to people that this is a safe place. And as a community, we promise you that we are going to be honoring your safety, our safety, and our communal safety. So our sign says, you are safe here. This is a safe place. No weapons are necessary. We do weapon check-ins. So if somebody has a weapon that they want to check in, we will have them checked in. They know where they are. They're in a closet. We also say, ditch your weapon. Like, diss it. There's plenty of places around here for you to go hide it, but you don't need it here. And part of it, it's not about the weapon. It's about it's about a sense of protection and community and responsibility for each other's safety, right? So we always say it's not about the behavior. Everything we do in programs is typically about the behavior. Do this and don't do this. And we create these structures and these rules. It's not about the behavior. It's about creating a protective environment and a community here. And this is a place where you don't need it. You might need it out there and we're not going to judge you for it, but you don't need it in here.
Shireen, you remind me of, we've been doing work in one of the jails and we're working with the officers and the residents together on understanding the impact of trauma. And when we said, let's come up with one thing that we can all do together today, and the officers and the residents all agreed if we could just treat each other with dignity and respect. And if we can live by that, a lot of the rest of it smooths out because people, you just have that motto, we're going to live with
Yep,
dignity and
that's
respect.
right. It's not that complicated. One of the things I say, because we get a lot of questions about safety, we have rival gang members that come into our space, right? And if you know street turf wars and the whole thing, the culture of gang, that on its surface sounds like it's really unsafe and it's really risky. Well, we work in community. If I go to Burger King, there is probably less safety measures in place at Burger King than there is in an environment like this. Because we know each other, we have a community here, we have shared belief systems and values. We work really hard to create a safe environment. I don't know if that's the truth if I go to McDonald's, right? And chances are I go to McDonald's and somebody's carrying a weapon there anyways. And so just possession of a weapon in of itself is not the mark of whether there's safety or not. It's about how we respond in this environment and how we set the environment up.
Right.
How are we doing on time, everybody? I need to do a time check.
We just hit the mark.
Mhm.
What? This has been fabulous. Absolutely fabulous. I cannot thank you enough, Rich and Mary and Vesper and Joan and Raul and Neely and everybody else that has made this possible. Michael, it's great to see you too. Thank you all for joining us today. I hope you found something that inspired you to reach out and connect with one another. I
And I think
appreciate
the
you.
Surgeon General, really, we can use that. I
Right.
mean, that report on isolation and loneliness is perfect to use as the basis of why we're doing this work.
No doubt, Joan.
And to have the Surgeon General behind it, believe me, we're using it.
Yep.
Your leadership is remarkable, Joan. I can't tell you how much I appreciate you.
It's why I let my hair go, Shireen. It's because I appreciate you.
You want to be twins. I love it. Anytime, baby, you and
You
me.
guys, thank you all.
All right, everybody.
Thank you,
Thank
everyone.
you. Mwah.
Thank
You.
you.
I find hope in listening to others talk about what they're doing to improve their communities and build community that overcomes isolation and loneliness. For more information, please follow the Women Arise podcast and also go to the links below. Hope you have a great day.